I am Dr. Nanda Rajaneesh. I am the author of a book called Life with Fibromyalgia. This book is based on my own personal experience of suffering from fibromyalgia, and also I have taken multiple references. This book is basically both for doctors and patients who are suffering from fibromyalgia, doctors who treat fibromyalgia. Fibromyalgia tender points depend on the kind of occupation the individual is having, and also there are certain common tender points in the whole body. For example, neck, especially the trapezius area, is very common for a person who does a lot of right hand work or hand work like related to computer and laptop. This is one of the commonest tender point in the shoulder, that is trapezius muscle we call it. And you can have the deltoid muscle pain and tenderness over there. So you can have pain in the finger joints also, the finger points. So this is in the arm. So sometimes the pain can be present in just below the axilla, that is large latissimus dorsi muscle can have a severe pain in the axillary area, so shoulder area. So that can happen due to imbalances in your lower back and severe center of the back. Patients typically, like when I manifested with the pain in my body, it was in the middle of my back center exactly. That is where the rhomboid muscle is there. There is a particular muscle I am naming because I am a surgeon, so maybe you may not be able to name the areas. So the severe center of the back, that is first common pain that you can start with, because a lot of neck strain causes that pain mostly. And you will have a lower back, that is between the junction of the spinal cord and the pelvic muscles, the two areas. You can have a nodule formation, or we call it knot formation in the muscle. Then you can have pains in the thighs, in upper thigh, mid thigh, knee joint and in the calf. So pain can be there anywhere in the body, but there are certain nerve points that are very common points, trigger knots we call it. So normally what happens is there is a nerve going and you do a repetitive stress in this area, that part of the muscle goes into spasm. When I discuss why the fibromyalgia happens, you may be able to understand that how these knots start.